Hi, I am Dr. Punitha Rangaraj, obstetrician and infertility specialist of Cambridge Hospital, also Bangalore. Normally, a female in a reproductive age will produce an egg. The ovary will produce an egg every month, that is called as ovulation. The time of ovulation will vary from person to person, or in the same individual also it may vary from month to month. So it is very important to know the time when you ovulate. Normally, in a 28-day cycle, if the patient's cycle is very regular, then the ovulation can happen anytime between the 11th to the 21st day. It is a myth. People think that ovulation happens on the 14th day. But if your periods are irregular, very erratic, then it is very difficult to predict the day of your ovulation. There are a few signs and symptoms by which you can, to a certain extent, know that these are the time of your ovulation. First thing is, just before ovulation, the vaginal discharge becomes a little more excessive. It is a secretion from the cervical mucus. And also it becomes a little more sticky during ovulation. Suppose if you take the secretion in between your fingers and stretch it, you may see a strand. That is a sign of ovulation. Sometimes you can have mastalgia, that is pain in the breast. Sometimes there could be pain in the lower abdomen, a vague pain in the lower abdomen, some bloating of the abdomen. Sometimes 1 or 2 drops blood also can be seen during ovulation. Not that all the symptoms will be present for everybody. 1 or 2 symptoms may be there. Apart from that, there are few other tests by which you can identify your ovulation. The other parameter would be, we call it as basal body temperature, BBT. When you check your temperature, as soon as you get up from your bed, you check your temperature and mark it in a graphic form. Definitely there will be a definitive change in the pattern of the temperature in the whole month. If you continuously do it for 3-4 cycles with the graph, you will be able to identify as to when you are ovulating, because normally there will be a little rise in the temperature after you ovulate. But it is not a very reliable method, because it all depends on how you record your temperature and how you mark the curve. And the second would be a laboratory test. Ovulation kits are available in the market. This is basically depends on the presence of a hormone called Leutinising hormone. There is an increase in this Leutinising hormone just before ovulation. So when you do the ovulation kit test, and if that shows there is a presence of this hormone, Luteinizing hormone, in your urine, that means you are going to ovulate the next day. Then you can plan your pregnancy, or if you want to avoid your pregnancy. The last but the most reliable test is ultrasound scanning. Do a follicular monitoring starting from the 8th day of your periods, and every alternate day. When the follicle reaches 18 to 20 millimeter, that means your egg is ready to come out. How to plan for a pregnancy or how to avoid a pregnancy depending on the ovulation time. Normally, the egg is active only for 24 hours in the body. But unfortunately or fortunately, the sperm is alive. Once it is introduced into the uterus, it will be alive for 5 to 7 days. So, if you are planning for a pregnancy, even if you have sex 1 or 2 days before ovulation, still there are chances that you can get pregnant. But if you are trying to avoid pregnancy, if you have had sex 2-3 days before ovulation, still there is a chance for pregnancy. So, you will have to plan in such a way that you should avoid having sex 3 or 4 days before ovulation, or if you are planning for a pregnancy, you can continue to have sex at least for that week.